Have you ever overstuffed a paper envelope with so many documents that the sharp corner tears right through? In the body, your lymph nodes work a bit like that envelope. They hold cells and are wrapped in a thin protective layer called a capsule. When cancer cells multiply inside a lymph node, they can eventually press against that capsule and break out. Doctors call this breakthrough extranodal extension, or ENE. Identifying this tiny tear is important because it tells your care team exactly how the cells are acting right at the boundary of the lymph node. There are two ways this breakthrough happens. First is microscopic ENE. Only a few cells slip out, visible only under a microscope. Second is macroscopic ENE. A larger cluster spreads past the capsule, sometimes visible to the naked eye. While a macroscopic extension happens much less often, doctors pay close attention to it because the larger volume requires a stronger medical response. Figuring out the exact size of the tear gives your medical team a highly accurate read on the immediate threat right there in that specific spot. Hearing that cells have escaped a lymph node sounds alarming. You might immediately wonder if the cancer is suddenly moving all over your body. Looking at this spatial map, we can see that the cells haven't entered the bloodstream or traveled far. They have only nudged into the immediate surrounding tissue, right next door to the node itself. Because the cells stay in that one local neighborhood, finding an extension like this does not change your overall cancer stage. Staging looks at the big picture, the total size of the primary tumor, and whether it has traveled to distant organs. The extension is simply a close-up detail about one specific node. This breakthrough provides a highly specific, localized look at how the cancer is acting. It is a vital detail that helps doctors see what is happening up close. This matters because the extension acts as what doctors call an independent factor. This means it's a detail that carries its own weight. It can increase the mathematical chance of the cancer returning to that area, even when your other results are very positive. Imagine a patient with a small tumor. Ordinarily, the model places them safely in a low-risk category, but spotting an extension in one lymph node adds a new variable, moving their calculated risk up. Crucially, up to 40% face this extension. It acts as a statistical warning light, highlighting a specific risk of local recurrence that other standard tests might overlook. Once doctors see that warning light, they use the information proactively to strengthen your treatment plan. This decision tree illustrates this. If the team is undecided, the extension breaks the tie, guiding them to radiation therapy. Branching further, it might persuade them that adding chemotherapy is safest. Notice the timeline extending. Stretching endocrine therapy provides better protection. The extension is the exact piece of evidence an oncologist needs to upgrade to a highly customized, heavily reinforced defense strategy. Through all of this, keep things in perspective. The boundary of a lymph node is just one variable your doctors weigh, alongside the size of the tumor and how your cells respond to growth signals. This finding acts as a vital piece of intelligence, allowing your care team to protect you with precision. When you go to your next appointment, you can take this knowledge with you by asking a simple question. How does ENE affect my treatment plan? By understanding what is happening right at the edge of that envelope, you turn intimidating medical terms into a practical tool for taking an active role in your own care.